Hi, everybody. For week 4 of our clinical conference, I saw a patient, AP, who was a 13-year-old female with a past medical history of long QT syndrome and a past psychiatric history of major depression, previous suicide attempts, OCD, and generalized anxiety disorder, who presented January 31st after a suicide attempt by ingestion of an entire bottle of Tylenol PM and an unknown amount of Benadryl. She reports taking the entire bottle of Tylenol PM and Benadryl with the intent to kill herself, and she had absolutely no remorse after her attempt and is disappointed that her attempt was not successful. And speaking with her grandmother, the patient started having some emesis before school on January 31st, and she did not tell her grandmother that she had ingested the medications. So she proceeded to take the day off for school because she was sick, and then shortly after, she started to observe she was observed by her grandmother to have some strange behaviors of laying on the floor, mumbling her words, and demonstrating some possible seizure like activity, which manifested as full body convulsions. So she called EMS and she presented to my ED for further treatment and evaluation. The patient does have multiple previous suicide attempts that her latest one prior to this current one was on 9/20/21, where she ingested Tylenol, some cough syrup, and she was also hospitalized physically and psychiatrically for that attempt as well. Outpatient, she is seeing a psychiatrist in the community mental health setting in Ann Arbor, and she also sees a therapist. But however, the patient's terminated her sessions with therapy, and because she refuses to open up and talk about her issues, and she doesn't open up to people who try to help her, and also too, she's refusing to attend her ECT treatments, which were found to be helpful during her inpatient admission previously. Her grandmother, I spoke to her separately on the phone, and she suspects that the patient has had an abuse history, but she's not certain of what type or when it possibly occurred. But the patient was suffering from some nightmares, but those have resolved. Relating to stress, she has been having some psychosocial issues at school with the teachers. She feels that the teachers have been picking on her, and also to her father recently died from an overdose on December 2021. And she says that this has been a great stressor for her, and she named that as the number one stressor in her life at this time. And also, too, she has somewhat of a chaotic home life. She lives in between her grandmother and her mother's home. So she lives part time with her grandmother, and the other time she lives with her mother. Her mother has a house full of children. She has one brother and two sisters, 16, 6, and 10. She has a past family history of paternal bipolar disorder. Paternal aunt and uncle also had bipolar disorder, and her mother has anxiety and depression. So, on assessment, when we went to go see the patient this morning, she's lying in bed, calm, dressed in a hospital gown. She was still continuing to have active hallucinations as she was grabbing at the air on the top of her bed as we were talking to her. She also has been reporting seeing people in the windows in her hospital room, as well as seeing some water behind the Veege machine because she's on a Veege to make sure she's not having any epileptic activity. When we were talking to her, her speech is very quiet and difficult to understand, and her eye contact was poor. She does report having some self-injurious behaviors of cutting her left upper arm. The last time she cut was on Saturday, and we did visualize those scars as well, and they're healing. So we let her and her grandmother know that we were going to be recommending an inpatient psychiatric admission after she has been cleared physically. But at this time, she's not cleared because she is still continuing to actively hallucinate. So the patient has had multiple failed um, medication trials of Intuniv as well as hydroxyzine, but currently she's taking bupropion XL 150 milligrams daily. But grandmother says that she's not taking it as prescribed. And although Wellbutrin was found in her GMS, grandma does not think that she took that as an attempt because she found the bottle in her backpack. For diagnosis, XX1 is major depression, XX2 deferred, XX3 QT prolongation, and acidosis due to her attempt, and access 4 is the recent passing of her father, and access 5 is 45. And when it comes to an article, I found an article that talks about the risk of suicide in the adolescent population, and it says that adolescent females are at the highest risk for suicide attempts. All right, thank you. Have a good day. Let me know if you have questions.